Good afternoon, everyone. This is Deputy Secretary Jen Smith. My apologies for being a few minutes late getting the webinar started. We're still navigating some changes that have occurred to our technology platform. So thanks for bearing with us. I'm sure folks are going to keep joining us here over the next few minutes. So we'll start with some housekeeping items and then we'll move into the content. So as you can see on the screen, a reminder that all of you are muted, so you are in listen only mode. We will be recording today's webinar. If you have questions or comments that you'd like to share with the group, please make sure that you're submitting that through the questions icon. So if you look at the screen right now, you'll see the red arrow pointing to the icon we're talking about. It has a little question mark inside a thought bubble. Do not use the chat option. So we really want you to use the questions, which has that little question mark there. If you have any suggestions for agenda items for our next stakeholder webinar, on the screen there you will see that there is a resource account, ra-omsas correspond at pa.gov. So we do monitor that resource account. We don't necessarily respond to the emails that come in. So that would be a resource account to use simply to submit suggestions for future agenda items. If you actually need to engage with us in some kind of conversation or dialogue or have specific questions, you would not want to use that resource account. You can contact us directly through, whatever other mechanism makes the most sense. So today is July 17th, 2025. Thank you so much for joining our stakeholder webinar. We've got a pretty full agenda, as you can see here. We're going to give a few both state and federal budget updates, talk a little bit about our integrated community wellness centers, or ICWCs. We'll get an update on the PRTF webinars and corresponding regulations, talk a little bit about Family Navigator, the joint licensing initiative we're doing with the Department of Drug and Alcohol programs, an update on the Four Walls solution, some regulatory updates, and then a short presentation on our Black youth suicide prevention effort. So reminder before we get into the agenda that our next webinar is scheduled for October 23rd at 3 p.m. Just a quick reminder about the use of AI bots and transcription tools. The Commonwealth does not permit these tools in Commonwealth hosted meetings. It is against the law in Pennsylvania to record oral conversations without the permission of the individuals involved in most circumstances. So by means of my next comments, I am letting you know again that this presentation is in fact being recorded. So a reminder, you all are in listen only mode. However, the recording will keep a copy of the questions and comments that you're submitting through that questions button. So if you're not consenting to have your question or comment recorded, please do not enter it in that box. If we see any AI bots or transcription tools attempting to log into the meeting, we will disconnect them from the call. Okay, so let's start us off with a few updates, and it says state budget, but I'm going to lump in there a couple of federal budget updates as well. As most of you know who follow the news, you would have seen that the week of the 4th of July, the big beautiful bill was signed into law at the federal level with some pretty broad implications to states' Medicaid programs. We will not have the time today to cover what's included in that bill. However, there are a number of different organizations that are hosting webinars or posting summary documents related to that bill on their websites or hosting them publicly for free at no charge. We would encourage you to take advantage of those opportunities to learn at a high level what's happening. We at the state level are still working to understand what all is included in that bill and what the implications are to us here in Pennsylvania. So we're going to need a little bit of time here to map out the timelines associated with the requirements in that act and really figure out what that means from a budget perspective, from a resource perspective, and how some of those impacts will trickle down to other organizations and stakeholders and members that we serve. So you'll be hearing from us at some point once we have a clearer picture and understanding of exactly what those implications are. If you have specific questions about that bill that you've not been able to find answers to or are hoping that we will at some point get further details about, don't hesitate to submit that to us. We are keeping a running list of questions coming in from stakeholders. And as soon as we get answers to those questions, we'll be publishing them in a frequently asked questions document on our website. So do feel free to pose those questions. The answers might benefit not just you, but perhaps others as well. So kind of tacking on to the uncertainty of what those impacts are at the federal level for the state fiscal year that began on July 1st of 2025 and runs through June 30th of 2026, we have not yet had a state budget approved. So the General Assembly, House and Senate are both still actively engaged in negotiations about that budget bill, determining what level of appropriation they will be granting to the state agencies and how that relates to the governor's proposed budget address. So we are anxiously awaiting still the outcome of that budget. I don't have more to share with you at this point. I can say, and we had said this in early 2025, even before negotiations began, it's going to be a tight budget year. It will absolutely be a difficult year, and that's reflected in the fact that we don't have agreement yet on a budget. There are some tough decisions that need to be made, and certainly, recent activity at the federal level is shaping what some of those discussions are looking like at the state level. So as soon as we know more, we will happily share that with all of you. Similarly, if you have specific questions, for example, about what payments are permitted to be made or not made during this time when we don't have an approved state budget, you are welcome to submit those, and we will do our very best to get responses to you as quickly as possible. I believe that there is some information being worked on currently that will be put out to stakeholders to that effect. But if you have a question in the meantime, please feel free to reach out and ask about it. So given that conversation around the fact that we don't have a state budget yet, we're not clear what that will look like, and we do know that it will likely be a tight budget situation, I wanted to give a brief update on where we stand with the integrated community wellness centers. I know there has been a lot of request for, what are the next steps with these centers. We had talked many months ago, prior to the federal administration change, about a plan that we had to transition this activity into a state plan service. And that was sort of the direction that we were headed late calendar year 2024. And we were anticipating that the federal government was going to be putting out something of a template for states to use that would be like boilerplate language around, what a state plan service would look like for these types of services. And we were waiting on that to occur and thinking that we would take that language and perhaps adapt it, tweak it a little bit, and work toward the creation of a state plan service. Federal administration changed. There were some priority shifts. There were some delays in getting information to us. And so, a period of time where we really weren't sure whether that was the path that SAMHSA and HHS were headed down. We didn't receive that language, the boilerplate language that we had expected to receive. And also during that time period, it became very clear that the 25-26 state budget was going to be extremely tight. And the reason that that's relevant to the conversation around our ICWICs is because when you're looking to create a state plan service, part of that process includes budgeting for those costs. And a state plan service has both the federal match component as well as the state share of expenditure. And so that has to be built into budgets, and we have to do some projecting around how much cost would be occurring related to that service. And when we were talking about the ICWICs particularly, currently we are limited in the number of ICWICs that exist in Pennsylvania, and we have certified those entities. We're aware of how many there are, and we have fairly good data around projecting what the costs might be. If we create, I'm sorry, could everyone make sure they're muted? I'm hearing some extra noise. Thank you. We have some sense currently of what that cost would look like. Creating a state plan service, however, then allows any entity that meets the requirements of that state plan service to be able to begin providing those services, which means there could be a large increase in the number of providers that are willing, able, and interested in providing those services. And, we don't have a sense for what that looks like, but certainly anything more than the current ICWICs we have would be an increase in cost to the Commonwealth. So given that, things are a little bit on pause in terms of what are the next steps around supporting our ICWICs and supporting the CCBHCs that were part of the direct funding arrangement from SAMHSA. So there's still a lot of conversation and work to be done in terms of, figuring out what that next step is from a funding perspective. In the meantime, though, we are working on some upgrades to the ICWIC model and focusing on things like improving our monitoring processes. We're going to be looking at creating some new policies and procedures that align better with best practices. We're going to ramp up the provision of our technical assistance to these centers. We'll be looking closely at the current data and fiscal reporting requirements and figuring out what do we really need to collect, what do we want to collect, and what's the best way to do that. And then taking a look at the performance measures associated with these centers. Now that we've had them operational for a number of years, I think we have some good experience to rely on to determine whether what we're currently measuring makes sense and whether it's really giving us a sense for how successful the services are. So Jocelyn, I believe you're on the line. Jocelyn is the Bureau Director that oversees this effort. Is there anything you wanted to add or talk specifically about related to ICWICs moving forward?
Thank you, Jen. You covered it well. I don't have anything to add. I just want to thank everybody for their patience as we develop our pathway forward and appreciate your cooperation. Thank you.
Thanks, Jocelyn. Anyone from my team, I cannot see the chat since I'm sharing my screen. Are there any questions that we need to respond to verbally that have come in?
No, Jen, this is Kendra. There was just a few questions that we've been responding to, and then there
Okay,
is one question about what RA account those questions should be submitted to, and we can put that in the chat.
great. Thank you, Kendra. Okay, we're going to keep moving along in the agenda since we got started a little bit late and we've got a lot more ground to cover. So I am going to turn things over to Scott Talley, the director for our Children's Bureau. Scott?
Thank you, Jen. Good afternoon, everybody. Want to provide a psychiatric residential treatment facility regulations update. Um, I think I mentioned in the last meeting that we had gone through all of our comments and we were going to set up some webinars to discuss some of the areas where we had the most comments. And so we were able to hold two webinars over one in April and one in May. In April, we met with the Transition Age Youth and Young Adult Committee from our Mental Health Planning Council. And we had conversations with them related to, many of them were in PRTS at one time, relating to treatment and safety and restrictive procedures. And it was a really, really rich meeting. We got great feedback from them. And then in May, we held a second webinar, and I'd like to thank PCCYFS and RCPA, Jackie Kreshock and Jim Sharp, who helped us to put this together. And we did a stakeholder meeting with the rest of the stakeholders, providers associations, BINCOs, family members. And we highlighted those significant sections where the regulations had received the most number of comments during the comment period. We were very well attended. It was 220 stakeholders that we have, and we did two things. One, we brought out all the changes we made because of the comments, which were several changes that we made, and then we went through some other areas where we didn't make changes, but we wanted to get feedback and possible solutions from the stakeholders. I have to say, all the stakeholders that we did it a hybrid, some people in person, some people virtual. Stakeholders were great, and we got some excellent feedback during that. So where we are right now with the regs is we're currently updating them before putting them back through the final submission of our internal executive review process. And our hope is to get it into that process in late summer, early fall. After that, then it will go back to the governor's office and then to the attorney general, and then we'll look to set up a meeting with IRC. So we're moving right along with the PRTF regulations. We are still getting some comments through our RA account, and every comment that we get, we still take a look at. I will say that we're not seeing many comments that are different than what we saw in the comment period, but we appreciate all comments, all questions, and we really appreciated the feedback we received during our two webinars. Next slide. So I want to also let people know that we have started a Family Navigator pilot. We are working with the Youth and Family Training Institute, who is going to be the lead for us on running this pilot, and it's for Family Navigator. And you can see it's to support children, youth, and young adults and family caregivers seeking mental health services and resources. The support can be as short as a phone call. It can be as long as 6 months. Our goal is to really help people to maneuver the system. We want to help them provide education, information, assist them with navigation, support emotional and practical needs, supporting family empowerment, which is a very important piece of this, promoting and facilitating collaboration and coordinated care, crisis support, and culturally competent care. Next slide. And these are the selected pilot sites that were chosen. I'd like to say that we're hoping they're very different models, and we're hoping to be able to use the models and use what we learned to provide technical assistance to help other counties and agencies to be able to do this in the future. The pilot is a 2-year pilot, which began in July. So if you want more information, you can see the website below there. I we could probably throw that in the chat as well. A lot more information. It tells you what each pilot site, how they're going to go about doing Family Navigator. So we're very excited about this, and we will do some updates as we move along in the process of the pilot. And I'm going to add one other thing. It's not on the agenda, but I wanted to make sure I let people know. Because there was not a new grant put out for system of care, there initially was one that was supposed to come out in December, then February, and it was never put out. We don't know if it will ever be put out. Our system of care grant ends on August 30th. So it's very unfortunate. We've had several people working on that grant within the Children's Bureau for 15 years, up to 15 years, and we will no longer have them as resources, which is both sad and unfortunate. I would like to tell the counties that are system of care counties now, we will be reaching out. I'm sure Mark Durkin, who's the director, has reached out to some of you as well. And we're hoping to still be able to provide technical assistance around system of care and maybe even some of the webinars that we've seen through the PA partnership. We're hoping to keep the website up. There's several webinars that are on there that are still very, they're up to date and they're very, relevant today. And so if you go to the PA Care Partnership, you can still watch those webinars. But I think that's all I have for today. I hate to end on a sad note, but thank you. And I am turning it over to, I can't see who I turn it over to.
So
That's all right.
Scott,
I can do it. Go
this
ahead.
is Kendra. There is one question that came in. There was a question from Larry Schallenberger asking, will there be an additional stakeholder meeting to discuss the financial impact of the regs on providers?
I don't think we're going to be doing a webinar related to that, but we're still working on the financial. We have said it's not going to be cost neutral, and that anything that's related to the regs that increase costs can be part of the cost reporting in the future. But we're open to any suggestions or any questions that come around the financial end. And Dawn, I know you guys are doing it. I don't want to put you on the spot here. I don't know if there's other things that we can do at this point. It's also, we don't know all of the financial pieces of it yet because we've made several changes and we have to go back through the ERP process.
Correct. We're still working on the financial pieces of this.
Thank you. There is another question that came in earlier. Anthony, I'm sorry I had missed that. Anthony House from Perform Care had asked about 988. Are we concerned about 988 given recent federal actions? I can go ahead and answer that, Deputy Smith, if you're okay with that.
Of course.
Okay. So we continue to move forward. Right now we're in year 2 of the grant with year 3, which would be the final year, set to start in September. We have had a few conversations with SAMHSA, naturally, as our part of our grant reporting efforts. We have heard nothing to the side that the funding is at risk come September. Unfortunately, we just won't know for sure until we are closer. As Deputy Smith indicated earlier, the governor's proposed budget, which included $10 million for crisis services, is part of that greater state budget negotiation. So we remain hopeful. Thanks for that question, Anthony.
Thanks, Kendra. Okay, we're going to keep moving here. Next on the agenda is Jason DeManicore. He'd like to give an update on a joint licensure initiative.
Good afternoon, everyone. The Office of Mental Health and Substance Abuse Services and the Department of Drug and Alcohol Programs are working together to reduce administrative burden on providers by conducting joint inspections of programs that have both a license from OMHSAS as well as from DDAP. Now, how this saves time is that providers will have one entrance interview conducted by both agencies concurrently, provide one tour of the facility, and have one exit interview where information is shared by both agencies related to any findings. OMHSAS and DDAP had a training with identified providers on Monday to outline the process. OMHSAS licensed psychiatric outpatient clinic, partial hospitalization, residential treatment facility for adults, and private psych hospitals that have dual DDAP licensure will be able to participate in the initiative. And individual outreach is occurring now to these identified providers. I did want to stress that completing joint inspections as part of this initiative is completely voluntary. And if a provider does not want a joint inspection, it will not occur. We'll also be surveying both providers and our staff who participate in this process about their satisfaction with the overall process, what worked well, what could be improved. We really want to get robust feedback from all participants so that we can continue to make the process better over time. Again, we have started outreach to the identified providers, and we're just really excited to begin the process. And that's all I have to share.
Great, thank you, Jason. Kendra, do we have any questions in the chat about this agenda item?
Let me scroll here. Yes, there's a question from Janelle Gleason. Should the affected providers submit a request to participate in the joint inspection or wait to receive that individualized outreach?
You should wait to receive individualized outreach. I would give it 2 weeks. If you don't hear anything within 2 weeks, please contact your licensing inspection staff from either OMHSAS or DDAP, and they'll be able to work with you to identify whether or not you're eligible to participate in the program, etc.
Thanks, Jason. And Sue, I hope that answers your question as well. They had a very similar question. So I think we are good.
Great. Okay, next we are going to turn the floor to Jill Stemple, who is the Bureau Director for Policy Planning and Program Development, and she's going to kick us off with an update about the four walls issue.
Thanks, Deputy Smith. This is Jill. Happy to talk a little bit. We've made some progress since our last stakeholder call on the four walls, in that we have now received CMS approval for our exception to the federal four walls rule that goes retroactive to 1/1/25. On the mental health side, that is inclusive of both our outpatient psych and our DNA clinics. In addition, OMAP has included in there some physical health clinics that are located in rural parts of the state, and they will be putting out communication on that on their end. On our side, we are still waiting for the state level reg barriers to providing services outside the four walls to be resolved. House Bill 1590 was passed by the House, but we are still pending that bill passing the Senate and being signed into law to hopefully abrogate some regulations in our payment regs for both the DNA and the outpatient psych clinics to allow services to be paid for when they're outside the four walls. When that happens, hopefully, we have a bulletin that is ready to go and waiting in the wings, so we will get that announcement out to the field as soon as possible when the state law passes, assuming it does. And please, if that's something of interest to you, make sure your General Assembly members are aware that that is an important action for our field. I'm going to go to the next slide then for regs updates. So two regulations that are our primary focus right now, our crisis regulations, have also made some movement since our last stakeholder call. They have moved to the Attorney General at the end of May. As I said on the last call, the Attorney General does have 30 days by statute to review, but that comes along with an authority to toll or pause the package to ask us questions, and the Attorney General has done that. So we're in the process of responding to some questions from OAG, but we are still optimistic that we will be able to get these out for public comment the end of August, beginning of September. Nothing in those questions was terribly concerning or that we think we can't overcome and work through with them. So we're very optimistic we'll still be able to go to public comment. The payment portion of the crisis regulations is following a little behind the licensing regs. So that is still with OMHSAS, but we are anticipating it moving into executive review for DHS in the near future. Our other package that is pretty far along, the confidentiality regs under the 5100s, are currently with our governor's office, and we hope they will be moving to the OAG step in the pretty near future, and also coming out for public comment later this year, probably mid to late fall of 2025 if things stay on track. We have a couple other reg packages that are in very early stages, inpatient reg, some work. I apologize, I had to mute for a second. There's a loudspeaker in the room I'm in that interrupted me, so I hope that was not too distracting. So there, our inpatient regs are in the very preliminary stages. We are working through looking at the feedback received from our surveys, both to the public and to our inpatient providers, processing that work. Our 1223 payment regulations are on pause while we're hiring for some new staff, but we're optimistic we'll get those restarted then later this fall when we have some positions filled. I did not have on a slide today because this came up relatively recently, but did just want to comment on a recent change at the federal level around the SOAR program, which is the SSI, SSDI Outreach Access and Recovery Program. It assists individuals who are homeless or at risk of homelessness of completing their applications for SSI, SSDI in a way that gets their applications approved at a much faster and higher rate than folks who do those applications without support. Unfortunately, the federal government has ended their technical assistance contract with the SOAR TA Center on a national level, meaning that we will no longer as a state have access to the training for SOAR or other resources that the TA Center has provided us. So we are working to preserve as much of that information as possible and move it onto the OMHSAS platform. That's a short-term fix. We know that's not going to solve the issue. It's not going to get us the training or necessarily keep those documents up to date, but we at least hope that carries us over while we can look at another solution longer term. So please stay tuned. Our SOAR worker on my team, Lauren McWithy, is in close conversation with all of the SOAR teams across the state. She's a great resource. If you have questions, please feel free to reach out to her. And if you have any ideas on how we can continue to support with the loss of that TA center, we're open to hearing suggestions or things that we can do to assist. I think that's all of my items, so I'll turn it back over.
Thank you, Jill. Kendra,
Jill,
did we have anything in the chat?
We do have a few questions. You know Jill always has the questions.
She does.
The first question for you, Jill, is there a number for the companion bill to House Bill 1590, if there is one?
No, it's not a companion bill. It is House Bill 1590 is currently with the Senate, so it is the same bill number.
Thank you. And then there was just a request kind of generally for any updates on the involuntary commitment forms.
Sure, absolutely. So my team has been looking at the comments we received on that during the pause. We're going to be meeting next week to make decisions on a path forward, whether we need to make any changes and reissue the bulletin or whether we will be staying with the forms as is. In either instance, we will have technical assistance in a training Q&A session, an FAQ to address the questions we received. But the exact timeline of that is going to hinge on whether or not we need to make any changes to the forms or the bulletin itself, which we will have that decision out before mid-August, along with information about what that means for the pause. So please stay tuned. We will be communicating that with our partners in the coming 3 weeks or so.
Anything else through the chat?
One just came in. Will Bulletin 2202 still be in effect after the passage of House Bill 1590 with the issuance of the new bulletin?
Yes, we are not planning to obsolete 2202 with the current bulletin we're working on. We are looking at a larger update to our telehealth bulletin, but that will be a separate action later this year that will not be connected to the House Bill 1590 and the Four Walls Exception Bulletin.
Thanks, Jill. That was the end of the questions for you at this point.
All right. Good questions, folks. Thank you. So it is my pleasure to turn this portion of our webinar over to Marcus Carter. Marcus is a Science and Technology Fellow assigned to OMHSAS through the Governor's Office. He has been with us for quite some time, and unfortunately his time with us is wrapping up in just a few weeks here. Marcus has been involved in a number of different projects with our office, some focused around integrated care, and most recently assisting with our Black Youth Suicide Grant Project. So really pleased to introduce Marcus to you and allow him to share a bit about what's been going on with this initiative. Marcus.
Thank you, Jen, for Deputy Smith for the great introduction. My name is Marcus Carter, and I'm with OMHSAS as a Science and Technology Fellow. And one of my major projects has been the Black Youth Suicide Grant. And this has been a grant project with Lincoln University. And it has explored the topic of suicide in Black or African American youth. There have been two convenings within our grant projects thus far. One has been at Lincoln University, and the other one has been in Harrisburg, Pennsylvania. In both convenings, they've been focused around interviews and focus groups, qualitative data gathering sessions in which we spoke to middle and high school students regarding their thoughts and experiences regarding youth suicide, mental health awareness, and associated topics. There was an average of about 200 participants for both events. Some of the topics included suicide awareness, again, prevention, societal barriers that could hinder a person from engaging in services, and facilitated touched on lived experiences, recurring themes, as well as unique insights. Next slide, please. Here's some of the highlights that came from both of these convenings, right? Importance of listening and emotional support. So, empathetic listening, responding with care, and generational differences can cause barriers to opening up and sharing. So, that was one of the major themes that we gathered from these forums. Some generational differences causing issues and nervousness regarding opening up the topic of youth suicide and mental health in the African American community. Mental health awareness and advocacy. Destigmatization was a very big topic that came up regarding the students that participated in our forums, as well as awareness and trust barriers, especially surrounding 988, not really comfortable reaching out, unsure of who might show up, who might find out that they reached out for mental health. Will 988 know where I'm at? Right. So just some uncertainty surrounding the advocacy portion, surrounding 988 being comfortable using that resource and sharing that resource with other youth. The topic of the role of youth and leaders and community figures also was a major theme that came out of our convenings. One student stated that, quote, "We don't see many Black therapists or leaders in mental health." And another student stated that there is a shortage of mental health professionals who understand our culture and experience. So, not seeing people that look like them or that they feel that they can relate to them were themes and ideas that kind of spoke to the differences within mental health and receiving mental health. The participants also touched on the topic of youth leadership and that they would want their voices to be heard in any type of legislation or joint ventures or joint projects that can speak to the African American community when it comes to mental health stigma and lived experience. Family and parental support. The idea of check-ins, right? Family involvement, open and non-judgmental and engaging conversations were things that spoke from the students, as well as cultural expectations. You know, the idea that well, the youth should just be happy because they have food and clothing and should not worry about, let's say, the other things that teenagers should be, usually could be concerned about. So, the cultural expectations of African American families that are just stoic, and what happens in this house stays in this house. And so, a lot of those type of topics and comments were made. And then finally, barriers and stressors affecting youth, right? Academic and social pressures, a lot of peer pressures. The topic of peer pressure and social media was pretty prevalent in their responses. Wanting the latest styles, influencers, and if the students' lives if they don't feel like their lives match up to what they see online, it could be really hard for them and devastating for them. But the idea of peer pressure and just generally the idea that the students really want to talk to another youth. I mean, I think that it was clear from the comments that the youth really get their socialization from other youth, and if it's any mental health education going on, they would be more comfortable talking to their peer group than any adult. So those were some of the things that really spoke up to us and spoke out as we continue the two convenings. We're planning two more in the coming future, and we're very excited about this grant and grant work that's been going on to explore this topic. And it's a pleasure for me to have been with OMHSAS, and I've really enjoyed my time here, and it has been a great experience, and it's such a blessing. So, with that, I'll turn it back over to Jen.
Thank you, Marcus. It's been wonderful having you with us, and I did flip to the next slide in case you all have questions. Marcus's email address is listed there. I'm hearing a buzzing noise. Is anyone else hearing that?
Yeah, Jen, I'm hearing it.
Yep.
Yeah. Okay. It's subsided. I was hoping it wasn't me just losing my hearing. So there's Marcus's email address on the screen if you have any specific questions. Kendra, did anything come in the chat related to Marcus's presentation?
Yes, there was one question from Lloyd Wirtz asking, was there any reference to involvement of clergy and religious leaders in the Black community in the feedback that we received from the individuals who attended?
Not specifically from the individuals, but from our Black Youth Suicide Work Group. I think that's another piece. Some of those protective factors, right? When it's talking about Black Youth Suicide, that's something that we want to explore. Getting our faith leaders involved and engaging with the youth. That's something that is usually a very positive aspect, and something that we want to engage in as a Black Youth Suicide Work Group as well.
Thank you, Marcus.
Hmm.
And then there was a question from Anthony House asking if there's an opportunity to partner with the TAEA Advisory Committee, which is a part of the Mental Health Planning Council, as part of the efforts around youth providing input. And Marcus, I'll go ahead and jump in here, just
Sure.
so folks know, when Marcus sadly leaves us in early August, myself and Shay Earhard will be leading the Black Youth Suicide Prevention effort, along with some other folks from OMHSAS and a greater statewide effort on the work group. Anthony, we can certainly put that on the list. Absolutely.
Good idea. Okay, before I finish us out with some reminders, I have two quick personnel announcements related to OMHSAS, and I think I've made these perhaps before, but it's timely and worthy of mentioning a second time. First is, many of you know Phil Mader, who has been the Director of Community and Hospital Operations here in OMHSAS. He has worked for 37 years with the Commonwealth of Pennsylvania, and he will be retiring officially tomorrow. So for those that know Phil, be sure to send him well wishes and a thank you on behalf of all Pennsylvania citizens for his lengthy service here with the Commonwealth. Many folks have been impacted by the good work that he's had a hand in. So we say a big thanks to Phil, and at the same time, a welcome to Paul Minnick, who will be replacing Phil in that role. Paul is on the call with us today. Happy to maybe have him say a few words at our next stakeholder webinar. He's excited to get working on the work here in the Commonwealth. He is new to state government, but not new to behavioral health by any means. He got his start in our field as a psych nurse, so really familiar with the population of people that we're serving and a real desire to have a direct impact on Pennsylvanians in a positive way. So a welcome to Paul. And then my second announcement is related to the OMHSAS Chief Psychiatric Officer position. This position was previously held by Dr. Dale Adair. Dr. Adair retired this past December. Again, someone who had been with the Commonwealth and with OMHSAS for many, many years, was a staple in the behavioral health field. We wished him well in his journey to South Carolina. He's really living life and enjoying time with his family. We have been so fortunate to make a selection for his replacement. Dr. Julie Graziani will be joining us in early October as our new Chief Psychiatric Officer here at OMHSAS. Dr. Graziani is currently employed at PPI here in Harrisburg, and she has a wealth of experience in community psychiatry and specifically serving adults and older adults. So just brings a great experience and a real motivation for being able to work now in a different kind of role, but still serving individuals and bringing her clinical expertise to bear. So two exciting announcements and big changes for us here at OMHSAS. So I'll wrap things up, Kendra, unless there's anything else in the chat.
Not at this juncture.
Okay. So just a reminder that our next stakeholder webinar will be held on October 23rd at 3 p.m. And again, if you have any requests or suggestions for agenda items on our next webinar, there is that resource account ra-omsascorrespond@pa.gov. In the meantime, I hope you all have a wonderful end to your summer and beginning to your fall. And if we don't see you any sooner, we will see you in October. Have a great one, everyone.